and welcome back to Chatting with Behavioral Health. I'm Cassie Uberheim, a licensed marriage and family therapist. As Mental Health Awareness Month continues, I think it's super important to discuss some information on mental illness. Now, there's a lot of definitions of mental illness out there, so I'd like to provide you a general definition today. So, mental illness is a condition that affects a person's thinking, feeling, or mood. Symptoms may manifest differently across different people, even if they share the same diagnosis. It's also important to know that 1 in 5 adults in the US cope with mental illness, so it's really not that uncommon. In addition, 50% of all chronic mental illnesses start before the age of 14. This is why it's so important to start the conversation about mental health early on. Many people are afraid to start this conversation because of stigma. Before COVID-19, 60% of adults in the US coping with mental illness did not receive mental health services in the past year due to stigma and other barriers. We may not realize it, but there are a lot of people struggling with their mental health right now. It's very important that we do all we can to make them feel comfortable reaching out for the support that they need. Some indicators that someone is struggling with their mental health could be an increased need for sleep, having a lack of motivation, expressing feelings of hopelessness, having an increase in substance use, perhaps feeling on edge, and also binging behaviors. We do anticipate that mental illness is on the rise during COVID-19, especially for frontline workers. Please remember that you cannot take care of others until you take care of yourself. It is okay to seek help. You are not alone in this. Resources can be found at slowbehavioralhealth.org. But I'd also like to give you some advice on how to start a conversation with someone who might be struggling with their mental health. When starting the conversation with someone who might be struggling with their mental health, it's very important to come from a place of compassion and concern. Plus, listening goes a long way, and listening non-judgmentally. It's okay to bring up what you've observed, and bringing up the topic in general might be a relief to the person because it's hard enough to bring up on their own. In addition, normalizing seeking help is another important step in that conversation. Now, I'd like to transition to talk about the Suicide Prevention Council. They are a great resource that can be found on Facebook. One of the reasons why we have this council in the first place is because suicide is the 10th leading cause of death in the United States. I should mention that local rates have not increased as far as we know, but it's still an important conversation to have at this time. I'd like to now read a statement from the Suicide Prevention Council. While SLO County has had a relatively high rate of suicide over the past decade, our residents continue to show resiliency and strength. Stressors and risk factors have and will continue to exist in our county, and we continue to encourage folks to reach out for help. Sometimes that means reaching out in support for others. If you think someone in your life is thinking about suicide, reach out to them. Ask them if they're okay and get them connected to resources in our community. I'd like to share the SLO hotline that is a 24/7 service. That number is 800-783-0607. In addition, Transitions Mental Health Association is going to be putting on a virtual QPR training, which is a training on suicide prevention. That's going to be this Monday, May the 25th. Thanks for watching.